The Trump administration is promising a coal comeback, but during President Trump's first 100 days in office, he signed off on many cuts to the federal government, including to an agency that protects coal miners from black lung. It comes as there's an alarming rise of the condition in young miners. ABC's Jay O'Brien has more from coal country.
Flag up there. Look at all this coal.
Take these winding back roads of Appalachia through the mountains of West Virginia, Tennessee, and Kentucky, where coal is everywhere. And you'll see where generations of miners have toiled, and where some have paid a severe physical price.
I can hear your breathing machines.
Oh, yeah.
I can hear you cough.
The lungs of these retired miners are forever scarred. After decades underground, these 8 men all say they have black lung disease, deadly and irreversible, caused by breathing in dangerous dust.
What's breathing like for you?
It's terrible. You are suffocating. Yeah. You are suffocating. And that's what's going to kill you. I got a wife and 2 kids and 2 grandbabies, and I want to live.
Their scars may be deep, but so is their pride in their life in the mines.
I felt like us in there mining that coal, we was powering America.
You were powering this country?
Yes. And also, my grandpa was a coal miner.
And around here, coal country is Trump country. He won every single county in West Virginia in 2024.
Raise your hand if you voted for President Trump. About half the room.
And President Trump has repeatedly called for a coal comeback.
Now we're going to put the miners back to work, and I said I was going to do this.
But in just 100 days, his administration cut 10,000 jobs from the Department of Health and Human Services, gutting the federal program that protects miners from black lung. It also paused enforcement of a new safety rule that would lower the level of dangerous dust in the mines.
Does it feel like you sacrificed your health?
Yes.
Yes.
All as coal country is already in the midst of a black lung crisis at its highest level in 25 years.
Oh, it's back or even worse than it's ever been.
Tonight, we're on the ground with a doctor on the front lines.
There are 30-year-olds dying from black lung?
And with the laid-off federal workers trying to do what they can to save lives before their jobs are officially gone.
There could very well be x-rays that are there that have been taken of men and women who have black lung. We don't have staff to read the x-rays.
Clarence, nice to meet you.
That's why these men came to talk to us, to speak out for the young miners they fear may not survive a new era of coal.
How does it feel to see this administration take those kinds of actions?
You're going to see more deaths, people getting
Yes.
killed. You're going to see more explosions. Everybody's going to let their guard down.
You think people are going to die younger?
Yes.
They take away the people that were watching over us, taking care of, they taking their job. We got nobody.
We have perhaps one of the most important pieces of legislation to pass in this Congress.
The federal government has decades of black lung protections already in place after Richard Nixon signed a law in the 1970s creating the National Institute for Occupational Safety and Health, or NIOSH, in charge of keeping track of the black lung epidemic, providing free x-rays and other screenings for coal miners, and helping sick miners get transferred to safer jobs. It's the only federal program of its kind in the nation. But recent cuts have gutted NIOSH by more than 2/3, hundreds of staffers, bringing its coal workers' health surveillance program to a halt.
It's devastated, it's terrifying, it's disheartening.
Dr. Brandon Crum, a 4th-generation miner turned radiologist, has been sounding the alarm about black lung's brutal resurgence. 1 in 5 long-term coal miners now have it.
If NIOSH is effectively eliminated like it is right now, you will lose the ability to diagnose these miners both early and later on, and it will also significantly affect their benefits. It's going to cost the entire United States more in the long run for their health care.
And Crum told us he's finding more and more black lung in younger and younger minors.
Why is it so much worse now?
There's a lot of different factors. One, we've ran out of the large seams to be easily accessed. We're mining smaller seams, which can be more difficult. It can have more rock. You have to have clearance for the equipment.
So it's the rock that you cut around the coal that kicks up all this dust?
Parts of the dust, yeah. So we'll have coal dust and rock dust, both. So this is a normal person's chest x-ray.
To explain how the disease can ravage a younger miner, Dr. Crum showed us this x-ray. A normal lung would show up in a dark color here, but with this miner, you can barely see his lungs anymore.
The rest of his lungs are just completely filled with fibrotic masses on both sides.
So how old is this guy?
This guy was, I think, in his 29 or 30-year-old when this was diagnosed.
This guy is 30 years old?
This guy's already passed away.
It's tragic cases like that are inspiring these federal workers to fight to keep their jobs. We were there as they rallied outside of the NIOSH office in Morgantown, West Virginia. On April 1st, Scott Laney and most of his colleagues were put on administrative leave. They'll be laid off officially in June. He wanted to show us where he worked for 17 years.
So it's just sitting almost unused, this whole building.
There's hardly anybody in there.
What's inside here that would be so crucial to helping figure out black lung?
Miners send their x-rays here.
Yeah.
We evaluate them for black lung disease. We've got 750,000 x-rays in the basement here.
Sorry guys, you gotta stop.
Oh, we gotta leave?
You can't be on site.
Oh, I'm sorry. He used to work here. We just got kicked out of the office that you worked for more than a decade.
It's his job.
And ABC News has learned hundreds of unread x-rays of possible black lung patients are locked away inside that NIOSH building. The doctors who should be reading them were terminated.
They'll go on continuing to be exposed at the rates that they are. Their disease will progress more quickly than it ever should have.
Kicked out of his office, Scott took us here, this dining room table at a former co-worker's house that he and his colleagues have nicknamed the War Room.
We had to send letters to coal mine operators to tell them, please don't send us any more x-rays, we can no longer process them.
Noemi Hall was also put on leave after working at NIOSH for 8 years.
Because you are all on leave and will eventually be fired, who's going to do this work when you're gone?
No one.
Nobody.
Yeah, I mean, that's it.
No.
Nobody else in the federal government does the work that we do to protect U.S. workers. Nobody else in the United States does what we do. When we are gone, when our work is gone, our research is gone, nobody steps up to take our place.
In a statement to ABC News, the Department of Health and Human Services said NIOSH and its Coal Workers Health Surveillance Program will continue to serve miners under the newly created Administration for a Healthy America. But they did not answer when the program's work would fully resume or how that work would continue without any of the experienced employees. Late tonight, Scott telling us that some on his team were called and told they'll now be temporarily taken off leave. But if they'll get their jobs back permanently remains unclear.
If there was a miner sitting here, what would you say to them about what this is going to look like for them going forward?
I'm sorry. I'm sorry for them. I'm sorry for their families. We're not here anymore to provide the resources that we've had for these 57 years.
Does it feel like you're breaking a promise to them?
It's absolutely a broken promise.
Back with that group of retired miners, many of whom supported President Trump, they now have a message for him.
If you had President Trump sitting here, what would you say to him about mine safety?
You don't take care of the miners, you ain't gonna mine coal. The machine don't run by itself, you know what I'm saying?
There is no block of coal worth any man's life or woman's.
One of the men, John Robinson, voted for Trump and firmly believes he will reverse the cuts.
He's a smart man, And I feel like he'll bring back a lot of workers, but the ones that was laggers or slackers, whatever you want to call them, probably ain't gonna get called back.
You have faith that he'll bring back
Yes,
those coal safety
I
programs?
do. I really do.
And what if he doesn't?
I feel sorry for the miners.
Will you think differently of the president if he doesn't bring those protections back?
Oh, yeah. Yeah.
At 59 years old, he tells us his doctors say he needs a lung transplant. And he hopes the next generation of miners don't end up like him.
The day you're born, you start dying. But when you're sick like this, it sort of puts it in fast speed there, overdrive. I may live to be an old man, I hope I do. But the odds is against me.